I'm Dr. David Beaulieu with more news you can use. Today, I'd like to talk to you a little bit about some of the latest research on gut health and depression. In a study reviewed in the November 15, 2013 issue of Biological Psychiatry. What? Biological Psychiatry? We're talking about gut health and depression. Huh? November 15, 2013 issue of Biological Psychiatry. Medical experts have discovered that depression is also associated with an alteration in the microbiota. Now, what is the microbiota? That's the bacterial milieu that fills our gut, fills our intestinal tract. And it's important to your brain. We've discovered, are you ready for this? I wasn't ready for this. The gut, your intestinal lining, makes more brain hormones, more neural hormones than the brain. Some of the modern neurologists, David Perlmutter comes to mind, are calling the gut the second brain. Gee, you know, if it makes more neural hormones than the brain, maybe we should call it the first brain. They're recommending for chronic depression a probiotic. All of the kids that come into my office go on a probiotic. Before we do anything else, adults all get a probiotic. When you're dealing with gut problems, and in my practice I have to, because my practice is almost all allergy and then nutrition, okay? So we've got to deal with the gut because leaky gut is a basic underlying cause, in my opinion, of all allergy. So we've got to put the good guys back, the probiotics back. We've got to try to balance that gut. We've tried to get the bad guys, if you allow me that, under control. This is a part of the treatment we've been at in my office now for 14 years. And they talk about gut health and autism. Parents of children with autistic spectrum disordered problems have continually reported and pleaded to their doctors that their autistic children's abnormal gut is involved with autism right from the start. What do you mean an abnormal gut? They're pooping wrong. That's how the parents know there's something wrong with this child. They're not having a daily BM anymore. They're having too much diarrhea. They're having too much constipation. We tell people in our office, we've got a poop test. We can do $1,000 worth of gut testing, or you can watch what comes out. What comes out tells you what's going on inside. Okay? And we tell the kids, no stinkers, no sinkers, no mess. Okay? If you've got odor, you have putrefaction. That's rotting. You got food rotting in your gut, and it stinks. So, no odor. Okay? No stinkers. We want the stools to float. If you have enough fat in your diet, I talk about fat a lot in these videos. If you have enough fat in your diet, some of it makes it all the way through to the end. And fat floats. So your stool should float. So daily BM at least one. Omnivores, we're all omnivores, by the way. The human being is an omnivorous animal. Is built to defecate after every major feeding. We move our bowels after every major feed. We train ourselves not to do that. We train ourselves to go once a day. Once a day is okay. Less than once a day is not. If you defecate every 3 or 4 days, you're heading for bowel cancer. You need to clear that stuff out of there. So once a day, no stinkers, no sinkers. If you have enough fat in your diet, your stools are going to float, no mess. Healthy animals don't mess themselves. They don't. If you've got puppies or kittens and they mess themselves and you've got to wash their butts in the sink 2 or 3 times a week, you know they're sick, you take them to the vet. Why is it okay if we go through a roll of toilet paper a week? It's not okay. We should be monitoring our bowel movements, and we should be monitoring the bowel movements of our children. No stinkers, no sinkers, no mess. That's worth $1,000. Everyday people thrust into the autistic world with one of their children have told their doctor that their child's gut is totally abnormal, often starting with the first dose of antibiotics. Wow. And that's a problem. So let's put the good guys back. Bad bacteria like processed foods, cooked foods in the American diet. Sugar, starch, wheat, gluten, and fast foods. So let's change the diet. Let's add some probiotics. The probiotic we use in my office is called iFlora. I think it's the best probiotic on the market. It's the one we've used for over 14 years. It's got 16 different strains, and I think the number of strains makes what makes this product a unique and special product. No stinkers, no sinkers, no mess. Pay attention to your family. They could be getting sick under your very nose. No stinkers.